Thousands of people in Kentuckiana are without health insurance, and many are choosing not to get medical attention because they simply can't afford it. But one church is trying to change that by offering a completely free community clinic.
Family Community Clinic is a project 2 years in the making. It's a cooperation between St. Joseph's Catholic Church and a dozen healthcare volunteers. They say this new free clinic comes at a time of great need in Kentuckiana for those without health insurance.
Well, the problem with people and not having insurance is they do not seek help in the early stages of their illness.
The Urban Institute says nearly 700,000 people in Kentucky are currently living without health insurance. Today, dozens of medical volunteers and St. Joseph's Church are hoping to help them, opening the city's newest free community health. It took 2 years, thousands of dollars in donations, and countless man-hours for the Family Community Clinic to become reality.
Here in the basement of a school, we're going to help people that maybe don't have health insurance have a healthy life. And of course, all of this is a display of the wonderful compassion that we have for the community, all of the tremendous leaders involved.
The free clinic is set up for doctors and nurses to provide basic health care for anyone in Kentuckiana without health insurance.
We will be seeing things that can easily be treated on one visit. So nothing chronic, no diabetes, no high blood pressure, nothing that needs to be followed long term. Our goal is to see people who have things like sinus infections, strep throat.
The clinic will be open Saturdays on a first-come, first-served basis from 8 a.m. to 12 noon at 1406 East Washington Street in Louisville. That clinic is open to anyone in Kentuckiana. The only requirement is that you have no health insurance. David?
It was in March, and I had found this lump in my stomach, and I told my friend, and she told me about St. Joseph's had a clinic in the basement, and so I come over here. I mean, I don't go to the doctor. If you're sick, you deal with it, but this was something that I couldn't deal with on my own. I set up an appointment, I came in, and then they saw me and felt that thing in my abdomen and told me to come back. They did blood work, and I was like, what's this going to cost? It's not going to cost you anything.
They come to you at their sickest. I even sometimes feel that they're a little afraid to come if they have something that we in the medical profession would think was negligible, because they are so respectful of who you are, of the time that you give them, and the attention that they get, because they just really don't think that they could get that anywhere.
I think I got the best doctors here. The volunteers that were here, they came in, and it was reassuring too to know that they had educated people that knew what they were doing to come in here and take care of this. They've been very kind to me. They called me to see how I was doing, and that everybody's thinking about me.
There's an incredible need in this community. We have such a population that is full of people who do not have insurance. We have many, many organizations, compassionate organizations in the city of Louisville that welcome immigrants into the city of Louisville. And of course, if you are an immigrant, you don't have insurance, nor do you have the ways or means to get medical care and the medical care that you deserve. So we have an incredible need here for this clinic.
The Family Community Clinic, what it means to our community, I believe it's a model for what can be done, for possibilities.
Imagine you don't know anything, but you feel that someone in danger. Instead of going to a doctor to explain to you, what is the situation and what kind of treatment, what you need, what are the recommendations that you need, just go to the emergency. Later you need to pay the bills and everything, and you don't know. Sometimes you say, well, maybe that's not really worthy to go. So it's kind of really helped us to come here. They helped us to understand the cases and to see what's our problem. And then after trying all the medicine and their recommendation, everything, we always come back healthy home. We cannot ever thank them enough.
We have interpreters here that help us with our Spanish patients. Now we have other patients that don't speak Spanish, of course, and those patients are a little more challenging to take care of, but we do it. We just do it.
First, when he came, he was so nervous. He doesn't speak English, so he feel like how he can explain how he feel. He feel better because he knows somebody can take care of him.
I think there's a main language, and the language is called the language of love.
I hope that at some point there will not be a need for a free clinic for uninsured. That we will get to the point where everybody has access to good health care. Until we get to that point, money spent up front to try to provide this type of care will realize savings in the long run. Individuals who don't have insurance or who are underinsured still receive health care, not in the most effective and efficient way, typically utilizing emergency rooms. This is a way of really improving that situation.
I come here because I need to come here. They never say no.
You see people who would not have the opportunity for medical care have medical care. You see professionals who are willing to give up a Saturday, give up a Thursday, and come give it up for people who absolutely need the best of who they are, and they provide it. So it's a joy that I can't even put into words.
This place is really the one that should be supported more.
Come see. Come see this clinic. Come see what we do. Come meet the people. Come feel the love. Come feel the compassion. Come look at the medicine and the way we treat people, because it's unlike anything that they would ever see or feel.
It's an asset to the community that the people that receive this are very grateful. I am, and you've probably saved my life. I made it. Thank you.